Dr. Fellows, would you say that organ transplantation is a medical procedure?
Is organ transplantation a medical procedure? Yes.
And would you say that for it to be done safely and effectively, it requires medical expertise and medical instrumentation?
It does.
In July 2006, the CDC reported allegations that the Chinese government was harvesting and selling the organs of practitioners of the spirituality Falun Gong. And the story indicates that allegedly these prisoners are being tortured to give consent for organ donation. The organs are taken from them, they are killed, and then obviously physicians not only would be involved in the removal of the organs, but in the transplant into the other person. Would you say it is unethical for physicians to be involved in this medical procedure?
I would.
Okay. And so it's therefore possible for a medical person to do a medical act with medical instruments and it be unethical in some situations.
Absolutely.
If you have a patient suffering from severe postpartum depression, she comes to you and says she has thoughts entering her mind, drowning her children in the bathtub, much like Andrea Yates in the United States did. What would you do if she told you she's seriously thinking about doing that?
Well, I'd ask her to seek professional help in order to avoid that calamity.
So you wouldn't in any way facilitate her idea to end the life of her children?
Not at all.
How late do you perform abortions?
23 weeks and 6 days.
And why won't you do abortions later?
Because by international standards and by definition, we consider the fetus at 24 plus weeks to be a person born at that time and could survive with medical interventions.
So if viability is moved back because of our technology improving, and it's now 20 weeks or 18 weeks or whatever, would you also correspondingly move back the point at which you perform abortions?
That would be determined by our society and obviously relates to, as you say, survival rates and morbidity. Morbidity being illness related to being born early. So again, the issue of the timeline, I think, is related to what our society decrees and not what I personally decree as an individual.
Would you recognize, though, that society has made decrees about how we treat human beings that are incorrect in the case of legal laws implemented that allowed for the discrimination of Jews or laws that allowed for the discrimination of women? That society can create laws. Would you at least agree that it's possible for society to create a law that is unethical?
In our modern societies in North America, I'd like to hear some examples of that currently.
But you would agree historically, we have the precedent that it's
historically
possible.
there have been atrocities over the centuries, for sure.
In terms of the abortions that you perform, which particular procedures do you perform?
Any procedure that my patient requires.
So a suction abortion?
Suction, abortion, dilatation, evacuation, reduction of labor.
Okay, so the image I had up there, the dilation evacuation, would you say that nucleus medical ars drawing is an accurate representation of it?
It's an accurate representation.
So it does require the pulling off of the limbs?
It requires more sedation, more sedation is what the term is.
The College of Physicians and Surgeons of Ontario have a document on induced abortion, and in that they say for DNEs beyond 13 weeks, you have to measure the length of the foot.
Mm-hmm.
Why is that?
Because by definition, if the fetus is greater than 500 grams or 20 weeks, it is called a stillbirth. And a stillbirth has to be reported to the government.
So if you do a D&E where the parts are literally all separated,
Yeah.
but the foot is of the length where you know it's beyond a certain weight,
3 centimeters.
or length, right?
Mm-hmm.
Then you will describe this to the government as a stillbirth.
That's correct.
Okay, thank you. When you measure the foot, is it attached to the leg?
Yes, usually it is.
Is the leg attached to the torso?
I don't measure the foot, actually. The foot is measured by the ultrasonographer prior to the procedure. And we know beforehand whether or not this is going to be a stillbirth or whether it's going to be an abortion.
Okay, well, then just the wording of the document made it sounded like post-procedure. Another document, the Society of Obstetricians and Gynecologists of Canada Induced Abortion Guidelines, says fetal tissue should not be removed forcibly through the cervix, as bone spicules may lacerate the cervix. Crushing and rotating techniques lessen cervical trauma. What precisely is being crushed?
Anything that's being crushed, it is being reduced in size or crushed in order to allow it to go through the cervix.
And what
So
is
whatever the
it?
size of the cervix, any part of the fetus.
And what is a fetus?
Pardon?
What is a fetus? The technical term fetus, what is it?
A fetus is a pre-born, potentially alive.
So is it not alive?
It is alive in utero, but its life is potential until it's actually born.
And what makes it an actual life at birth?
It's a life at birth if it is able to survive on its own when it's born.
Can a premature child relying on incubators survive on its own, or does it need an incubator?
Over 24 weeks, they generally can, yes.
Without an incubator?
Rarely.
So they need something for their survival.
They need something.
And if no one operates the incubator or provides them care, they will die.
Yes, usually.
So they are very dependent on someone or something for their survival.
Absolutely.
So what is the difference between that and a child that is in his mother's body, other than a degree of dependency?
Well, up until 24 weeks, there's the only difference is, as you say, that dependency. Before 24 weeks, even that dependency cannot be met by our society, or any society for that matter.
But why does dependency determine our right to life?
Well, it doesn't. In fact, there are no laws in Ontario or in Canada and in many of the states which determine an age at which abortion cannot be done. This is a general sort of philosophy by countries, non-third world countries, that support the idea that we generally will not do abortions over 24 weeks in respect of the fact that these fetuses, when born, could survive and be intact survivals.
Thank you.